Thank you all for joining us today. Welcome to this webinar titled Prioritizing Health with Youth Leaders, Change Agents in School Health Council Work. As a quick introduction to Sophe, Sophe is a nonprofit organization founded in 1950 dedicated to providing global leadership to the profession of health education and health promotion and to promote the health of all people. Members include health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. Please plan to join us for Sophe's 21st Annual Advocacy Summit, which will be held on from October 19th to the 21st in 2019, in Washington, D.C. We encourage you to visit the Sophe's website for additional information. And now I'm excited to introduce Kristi K, President at Health Empowers. Kristi serves as the consultant with Sophe on the school health team. She will talk a little bit more about our project and introduce today's speaker, Christina Cody. Kristi?
Thank you, Deanie, and thank you everyone for taking time. We're very excited about the School Health Council work that we are doing. In addition to the 3 webinars, this is our second of 3 that we are providing. We're also working to develop training modules that will help schools and districts all across the country in implementing school health councils. But my exciting role today is to introduce Christina Cody as our presenter. Christina has a background in education. She's been a secondary science teacher, but what sets her apart is she has also advised a student-led group called Fit Together, and this is in the Cherokee County School District. Fit Together is a student-driven initiative that really is designed to catalyze a culture of health by using empowerment and also collective action. In this Fit Together project, Christina has explained to us that it has 3 components and each focus on a different population. So Fit to Learn focuses on the students, Fit to Serve focuses on the staff, and Fit to Prosper focuses on the community. So bringing all of those entities together. But what's really interesting is how she has used students as change agents in the schools in Cherokee County. She has used these young people to identify barriers to health and well-being, and then has had them design solutions to make not only their schools, but also their communities healthier. Christina is also the co-chair of Eat Smart, Move More, Cherokee County, and is a Robert Wood Johnson Foundation Culture of Health leader. Many of you know of that national leadership program that fosters collaboration between people from lots of different fields and professions that have any kind of influence on people's health. Christina loves to help schools and communities and loves to make health a priority for all. She believes in youth empowerment and partnerships that can create a culture of health for all people while building tomorrow's community of leaders. We're very excited today for Christina to share some of the successes and the lessons learned that she's had with the youth-created organizations that she has developed in Cherokee County. So without further ado, Christina, I'll turn it over to you.
Thank you so much. I am honored to be here and to share on behalf of my students the initiative that they started quite a while back. You see a few of those kids there. It's a privilege for me to be able to tell their story and to have other organizations recognizing their hard work and what they've been up to. First of all, with all of my speaking engagements that I talk about them, I have to pay homage to the Cody clan that kind of started it all. Back in 2013-14 school year, I presented our obesity rates of first, third, and fifth graders my anatomy and physiology students. I've come across them in a Google search, actually, and this was a partnership that they did with our Department of Health and Environmental Control. So we had local data, and the numbers were astounding. And I was just shocked by it. It wasn't in my lesson plans. It wasn't anything we were going to discuss that day in class. I just found them and thought I'd share. And the students were really moved. But really what really, I guess, pushed us in a direction of action were our disparities. And I didn't even know what a disparity was as far as public health. I had a biology background. I had been teaching science for quite a number of years. And this is our most recent data here under questions, and it kind of goes along with how we kind of came about. But as you can see, we had some quite significant disparities between race and poverty levels. So I had a student in my class, and he asked me a question that I really couldn't answer. And he said, so because I'm black, I can't be as healthy as a white person. And if you look at the data, that's exactly what it says. And I didn't know anything about social determinants of health. I couldn't answer the question, but it really just resonated with me, and I couldn't get this kid's question out of my head, out of my heart. And within the next week, I signed up for another master's degree to be able to learn more about health education and promotion and be able to really do something about it, because the kids were just motivated. They said we got to let people know what's going on. So that's what we did. We come up with a plan. The kids took on this project. They made a brochure about our data, about what resources we had locally, about social determinants of health that we learned in our research. And they created this brochure. The superintendent got wind of it and made a copy for every student in the district to take home. And that's really how we got our name out locally as part of Fit Together, because we knew it was going to take a whole community to tackle these issues. So it really wasn't about obesity so much anymore as it was narrowing the disparities here and really focusing on equity. So they come up with these ideas to host these physical activity events called Super Saturdays. These are high school kids that were hosting events for all elementary school students and middle school students and their families. We wrote a grant with Fuel Up to Play 60 to get some equipment for these things. My students also designed physical activity and lessons that they remembered from elementary school. So we looked at standards that elementary schools and middle school teachers were teaching their kids, and then we put a physical movement to it. And we talked to teachers about how that solidifies the learning with brain development and all that. We had students go into elementary classes teaching about nutrition and sugar and marketing to kids and the dangers of that. So it was really, really cool to see these students taking the lead on this and getting the word out. And as these stories were shared and we just kept getting more and more support, it was really easy to gain partnerships with youth-led initiatives, because I don't know if you guys know this, but teenagers get a bad rap, especially these days with technology and all that. But here we had a large group of teenagers that were really out trying to make a difference and for their younger counterparts, and it was really touching. And that's why I was so motivated to help, is what could I do as an advocate, as a voice for those kids. So we also were looking at our wellness policy with the national level legislation and having to redo that. So I volunteered at the district office to kind of head that up based on what I was learning in my graduate program and all that. And so I pulled students in to that committee, and then I also, every step of the way, whatever we decided to put in that wellness policy, I took back to my classroom. And so my students were evaluating the policy that we were writing. And so it was really good as far as accountability goes, in keeping me accountable and keeping what we put in the policy accountable. And it's really hard for administration to turn down or to say no to what a student may need, especially in an education setting. So we had some really good successes with promoting health, and it was all due to a lot of our partners. And so here you can see some of our most active partners, and when you reach out to these, or students would reach out to these as well, they were all on board. It was always yes, whatever you need. And so we tried to also, say, what can we do for you? Because that's really what we want to build, is a reciprocal collective impact. And so we would provide trainings, we would provide student help, and wherever we aligned, we were there and to support each other. And so it's really worked out, and anytime we need anything, we reach out to these partners, and they're there for us. So it's very rewarding to be a part of that. So as we were looking at our disparities, it was obvious that equity was a major piece, and we use a gear here in our logo and in our presentations to show that a gear by itself doesn't do anything. So the way gears work is you have to have multiple gears to make the overall machine function as a whole, and that's really what health is about. Health is foundational to a lot of other things that people don't really get in other areas, because it affects economics, it affects education. Even all the social determinants of health, they're all linked. It all comes back to health, and so we wanted to be sure that we use that model to show how things fit together, literally fit together. So our program FIT stands for Fitness Integrated Thrive. And we don't want to just be about physical fitness. Most people think, exercising and eating right. But we know, especially in the classroom environment that I've been in my own family, in our own community, we see that it's mental, emotional, and social as well. So we wanted to be sure that we were holistic in covering all types of fitness in our program. Youth engagement and leadership, it's what started us all. So for me, as my students graduated and went off to college and the next group came in, that was where my main focus was, and what do our kids need? And what do you want to do with the program now that you're in this class, or you're working, you're volunteering to be in a part of this movement? And then you really can't get away from the whole school, whole community, whole child model. I feel like that whole concept is exactly what it takes to help students be their best as kids, as adults. It's just a holistic piece that all those components just make sense. And we know it's such a simple model, but those are the pieces that we need, and those are the pieces that we're not always getting in school districts. So our overall goal from these gears and these pieces were to have healthy and productive students, healthy and productive staff, and ultimately healthy and productive communities. And I hope that you're familiar with the Wisk model here. If you're not, I strongly suggest you take a look at it. It puts the child at the center, exactly where they should be. And it states that every child should be safe, engaged, supported, challenged, and healthy. And in my school district, we were doing really, really well at challenging them, engaging students. That was part of our professional development in the classroom as far as that goes. Safety, as in the times we live in, that's become a bigger concern with everything going on in the world and in some of your communities. It's disheartening, but safety has been a bigger issue. Supported has been troubling in that we feel like we don't have the resources we need to support kids. But healthy was always the last facet that we just really never focused on. It was, well, the schools think it's the parents' responsibility and the parents think it's the school's responsibility, but we didn't teach the parents health education the way we should have. And so it was a battle for sure. But we found so much so that when the kids were coming forward and say, look, we need this, it was a lot easier. We had been talking about food and nutrition for 3 years and no changes were made. And then this year we actually have some major progress going down in my district. I think it's really important to be sure that we all have a common language when we set out on a mission. And so these were some terms that were, and infographics that were developed by Cohort 1 in the Robert Wood Johnson Foundation Culture of Health Leaders. So some colleagues in Cohort 1, I'm in Cohort 2, but I just thought it was a great graphic representation to explain the difference between equality and equity. And I feel like it's just a really powerful image that shows really what communities need. Equality isn't always the way to go. It doesn't really help people be their best where they are, and that's where equity allows for those opportunities to attain their full potential. And I feel like one thing we've focused on in our organization with students is using that equity lens with every decision we tackle. So, when our students start developing their programs, we're like, okay, who's going to get the benefit and who's going to get the burden? As we develop policy that we present to the district office or the community or city council or county council, it's always who's getting the benefit and who's getting the burden. And I feel like if more organizations and businesses even, use that type of mindset and guidance, I think the world would be a better place. I think we'd make better decisions for lots of people. So I teach this to my coaches. I teach this to my student groups that I'm working with, and to help them start to determine how they can be more equitable in their lives and in their decisions and whatever career they go into. So what we really want to see from our youth engagement and leadership piece, this is ultimate learning. This is, you have a community problem, you go about learning what's causing it, the root issues, and you go about finding out ways to solve the problem. And I feel like that's stuff that you really can't learn in a textbook. I know from a health educator standpoint, you can learn all the theories and programs and logic models and all that good stuff that you use and stuff, but you really don't get the full experience until you get into the community and you got boots on the ground. So talking to people, getting that input is really, really important. I love that my students take ownership in their community. A lot of, like I said, teenagers sometimes get a bad rap, but these kids really want to make a difference. And so it's really, really cool to see them beaming with pride when they're noticed, when they're asked to be at a table for a discussion about a rec center that's about to open, or a new superintendent that's coming in. So it's just really nice to be able to advocate for these kids with fellow adults and say, hey, these kids are moving mountains, and you need them at the table. So the service and growth component, school and community pride, teaching them some civic engagement. Some of their issues that they want to tackle involve policies and change in different organizations and even at the city and county levels eventually. So teaching them that whole process and hopefully creating future leaders in our community. And then being able to see your impact in your community. I hope all of my students come back and want to live where we live now. And that's not always the case, but I hope they come back and make it better. So that piece is the most rewarding for me, and it's kind of the whole reason why I went back to school, and I'm just such a huge advocate for for their work. So like Kristi kind of explained, we have 3 components to our initiative here. Fit to Learn involves student teams in every single building looking at their needs assessment for their school based on wellness. So they evaluate their schools, they come up with something they really want to focus on and work on, they survey their student population, and then we help them develop the program. And then they evaluate the program. So it's really cool to see students working in their buildings on issues that benefit them. And it's even really neat to see how our different schools are approaching these issues, and they have different issues. We're a small rural community in South Carolina, and we have 20 schools, but they have their own culture. They have their own things that they do well. They have their things that they really need to work on, and wellness is no different than that. And so it's really neat to hear the students' perspective on what they want to focus on, and it's not always what the adults think they're gonna want to look at. So part of it is really trying to support teachers with the health education standards. Honestly, we don't do a very good job of that, just surveying teachers. They don't feel comfortable with the curriculum. And so how can we integrate that into current standards and current core classes? Because number one, teachers don't have time. And so how can we make sure that, for example, if you're teaching math, instead of using word problems like, Sam has 14 cupcakes, why can't it be something healthy? So we talk about those little things you don't always think about that you could squeeze in some nutrition, or subliminal marketing for some healthier choices, instead of getting kids thinking about sugar. We do some fitness support. So if a teacher wants to coordinate some physical activity in her lesson or his lesson, then we jump right in and we help them out with that. We've done some taste tests in schools. That's really fun, and some nutrition lessons that are physically active. So the Fit to Learn is all about making sure we support our student teams that are working on these things, their projects or their initiatives. And it's also, I don't always tell them this because, I don't want to, but we ask schools to recruit those students that may not be completely engaged in school, may not be, I don't want the highest grades. I don't want those kids that are invited to be in all these clubs and organizations. I want the kids that really don't like coming to school. I want those kids that are identified as behavior problems, because those are the ones that we're not serving well as a school and as a system. And so that's the voice we need at the table. And what we hope to see, and these are K through 12 students, so we're even working with kindergartners, and they're the ones that are blowing it out of the water. Like, I don't tell many people that, but they're crushing it, just because, and they're one of my favorites. So what we hope to see with the Fit to Learn program is increased school engagement, academic performance going up, attendance going up, and, of course, discipline going down. And you can't really focus on student programs without working with the people that are in front of them every day. Teachers are so influential, principals, custodians, food service staff, secretaries, administrative assistants, all of those people are in front of students every day. And so it's our job to serve them well. So we knew we wanted an employee wellness piece to it. And we have lots of testimony from teachers who have changed their life and changed their pattern of their lifestyle, and it's helping them not only in their own families but in front of students. And we've had a great time with that. We've had a volleyball tournament going on this year. We lead twice-a-month workouts for free. We negotiate for gym discounts, and all of our gyms were on board this year in our county. And we hope that teacher morale improves. It's a tough time in the education field right now with some legislation that's coming down in my state. And it's not even about pay. It's a tough time with all the testing, that's the pressures of that, and performance and data that's really weighing on a lot of teachers as standing in front of a class and seeing your students' needs, but then the needs that you're measured on don't always align. And so the students are human for us, and it's a contradiction that we kind of sometimes feel at different levels. So we hope that staff attendance increases, teacher effectiveness increases, and of course school engagement from the teacher's perspective and the employee piece. And then our student teams are working in their buildings this year. Next year in our initiative, we're going to team them up, and they're going to focus on their community. And so they're going to do the same thing, a community assessment. We're partnering with Eat Smart, Move More, and Know2, which are community-driven organizations and nonprofits, to do a community assessment and get student voice in that. And so they're going to do the same thing with developing these initiatives within our little small communities that surround our schools. And so I don't even know what those are going to look like yet, but I'm so excited as far as that piece goes. So we really want more community engagement, cross-sector partnerships, because it is going to take all of us to really move the needle. We hope that community pride increases, and then student ownership in their community. And disconnected youth, we want to go down. We have a 21% rate of disconnected youth, and that's the whole purpose behind in our program expansion. That was why I really wanted teachers to recruit those students that really aren't just feeling school. They don't want to be there. They're there because they have to be. They don't feel included, and that's the ones we have to serve better. So I'm excited to have a lot of those students and to have some good progress with those students in our district. So our Fit to Learn piece, we've been really busy this year. We have been able to, whatever these student teams come up with, it's my job to find out who's doing it well and take these kids to see it. And then also, if these kids need money, it's my job to help find the money to fund their projects. So up in the top left corner, we took 2 student teams who were really worried about recess. Their schools weren't getting the minimum requirement of recess at all grade levels that our policy states. So instead of, getting these students on a war path to say, it's in the policy, you got to give us 20 minutes, we went to a school in Pickens County, which is about an hour and a half away, who is trying out a pilot program called Finish Fridays, and Finish meaning Finland. And so they work in multiple times during the day for physical activity, and they have some initial data that shows that student attendance is up on those days, academic performance is up because of this, and then also the principal has less discipline on those days. So these kids were really, really interested that they were going to try to get a lot more minutes of physical activity time, but they didn't want it just twice a month. So they actually have been working on schedules for next year to present to the principal, and they've already presented to the principal, and they even invited one of the principals to come along, and he's standing right there in the middle of that sign. And they took a lot of notes. They talked to kids. They talked to teachers, and so they were able to bring back those stories and present to their schools, and they've worked on a schedule, and hopefully they're going to get some extended recess time next year built into their day. I think it's going to work out nicely, so that was fun. This picture in the top middle are students from Gaffney High School and our Institute of Innovation, and they wanted to do a healthy store that was available for students to purchase food that was a healthier option, at the same time be able to raise money to fund wellness things that they wanted to do in the school, maybe events or purchase equipment or whatever they wanted to do. And so we went to J.L. Mann in Greenville County, and they have a PTO president who actually runs their store, and she is the only fundraiser at that school, and she's able to bring in $45,000 a year that she donates from the PTO to the school to support anything they want to do. They're able to do mini grants and stuff like that. But they were more interested, our students were more interested in what is she selling and how is she so successful. So we got to go there, and they were so gracious. We ate lunch with them, and it was amazing just to be able to see something like that and what's possible. And it really motivates our kids. Here in the top right, we have the equipment left over from our grants that we were doing. So when I was in the classroom, I really wasn't able to do anything during the week, so we did Super Saturdays. But now I get to travel to schools and be able to provide this equipment for incentives for kids, or for just even on a recess. Maybe, the recess, the playground isn't so great, and so we have this equipment we're able to take. You can see some pictures of some taste tests that we did with kindergartners there, some nutrition lessons that we were able to provide to first graders. The fruit guys in the middle kind of look like Fruit of the Loom guys. That's our Fresh 5, and we've added a watermelon to it, so now we got 6. We got a Super 7 we got to work on, I think. They are at Alma Elementary School, and they're working on recess as well. Recess was a hot topic this year. The picture in the middle are students from Blacksburg High School who really wanted to focus on school lunch. School lunch has cafeteria food in general has a bad rap, but these kids really wanted more wholesome food, more nutritious food, and better options. So we took a trip to Greenville County Schools. We ate at Fisher Middle School thanks to Mr. Joe Urban. He's transformed what school food should look like and taste like, and he invited us to come eat. He spoke with our kids. He told them some changes that could be made that were free. And our food services director, this kid's invited her, and she was all on board. And so now, because of them, we have some training set up for our staff coming up at the end of the month. And the students are actually picking the menu for next year, and they're going to do some taste testing. And so they're going to transform the entire district's menu for next year. And so we're moving from a chicken patty sandwich to some shrimp tacos and some orange chicken, and they're going to do it up right. So we're excited to have the training available to where we can focus on meeting those budget requirements while at the same time getting tastier, healthier options so the kids will actually eat food at school. We were featured on the news. A lot of our groups were featured on the news, so that was really fun. And that's a really important part, is marketing what these kids are doing in their buildings. And that's my biggest, my top priority, is making sure the word gets out of what these kids are doing. Down at the bottom, you can see this little guy. I had a teacher contact us about some kids were struggling with body image, and so we used my son's bearded dragon to talk about what people look like and what they're really like, because he looks like he'd bite your face off, but he's actually really, really sweet and likes to cuddle. So it was a great story time. I got to hear some stories about kids being picked on, about their hair a certain way, and so they were able to bring that to the class and then tell how they overcame it and how they were resilient. So that was a really nice piece. The Fit to Serve component, here's some pictures from our volleyball tournament, and we always invite our staff. We've led some fitness events at schools, after school hours for teachers, and we get really good feedback about just the stress relief that that it just helps so much. And this is a workout room we created before I left Gaffney High School. This is with students. This is one of their projects that they did before we left. We wrote some grants and got some equipment that's open to teachers, it's open to students, and so we let a family workout here. And then we also, students can't really do this because they're in class, but as part of our Robert Wood Johnson Culture of Health Leaders, we let a field day, adult field day, as part of our conference. So if you guys want to check that out, if you're scheduling a conference, we can totally hook you up with what we did. It was a lot of fun. But the teachers here love the volleyball tournament. They want to do kickball. They want to do softball. They want a chance to kind of cut loose after a hard day. So working these into policies and getting principal support is so easy when it comes from the kids, and it's just straight from the horse's mouth, and it's just hard to tell a kid no. So our Fit to Prosper piece, that's going to be fun to watch. So if you want to keep up with us, we're on Facebook, Instagram, and Twitter. I have no idea what these kids are going to find that they want to focus on in their communities. If it's anything like the school projects, it kind of varies, but it'll be interesting to see, and I'm excited about the evaluation piece. So we're going to have our celebration tomorrow night. If we have good signal, we're going to try to go live, but just pulling in the community is so important. I want to share a really cool story from our primary school. Our primary school is Blacksburg Primary, K through second grade. And I get a lot of questions about what age groups do you engage in this type of work. I mean, this is work that public health professionals are doing with a needs assessment, designing a program, and evaluating a program. And I don't want to diminish any kind of degrees or certifications that people have, but these kids are doing it, even at the kindergarten level. And this is Gracie. She's on the team at Blacksburg Primary School. She's in first grade. And they wanted to be able to get more kids to eat fruits and vegetables. Their cafeteria served some, during the day at lunch, but a lot of kids weren't eating school lunch. But they wanted to be able to get more fruits and vegetables into the hands of kids. So they wanted to do a store. So their first idea was to put a Walmart. They wanted to build a Walmart on their playground. And so I kind of talked to them a little bit. I thought it was a great idea. I felt like we would have some zoning restrictions. So I talked about what that was and how we really probably wouldn't get enough money to do that, but space was also limited. So we kind of got them to brainstorm some other ideas, and they were talking about an empty classroom space, but they wanted to also be able to show parents what kids should be eating, and that was their words. So we brought up the idea about a market, a little market that you can move around. So we called it a mobile market. And it was really, really cool idea that they were going to have this mobile market where they could sell stuff. And so I asked them, who's going to work this? And all in unison, they were like, we are. And it was exactly what I wanted this program to be. So Gracie is there this day, and she's like, Cody, I lost my first tooth. And I was like, no way, that's crazy. Look at you. And she was all excited, and she was saying that the tooth fairy was going to come that night and all that stuff. So I'm here working with Gracie, making a list of things that they're going to need as I write this grant application to try and get some money to put this mobile market together. So the next day I get a text message from the teacher, her teacher there, who is also the wellness coach, and Gracie brought in her $5 from the tooth fairy to give to Miss Cash, to give to me, to put towards their mobile market. So that just, literally made me cry a little bit, because I'm telling you, if you don't get anything else out of this webinar, if you're not listening, engaging, amplifying, supporting, and promoting our youth, what can you really expect our future to look like? And so just asking kids what they need a first grader even, and she was all in because we asked. So I think that's really powerful, and it really speaks to what youth deserve and what they need. So getting into what I've learned this year and what I'm hearing back from our kids, we've had students who were behavior problems, and I've had parents say that one particular case, he's a different child. I have kids that are some of our students are going to principals and bugging the snot out of them. We need this, we need this, we need this. And so that's exciting as well. So they know we're listening now, and that's good. You can see in the top the little graphic drawn there. That is the Blacksburg Primary logo that they created for their Healthy Cats Market, their Wildcats. And so they also wanted their faces on their favorite fruit. So we're going to get some stickers made with their faces that we put on their favorite fruit, because I don't know where they learned this personal branding in first and second grade, but they already know it. So that's one thing we're going to focus on. I think one of the most important things that my students taught me from the very beginning was just fearless action. They were not scared of failing. They were not scared if anybody was going to listen to them or not. They knew that they had to get out there, and it really just motivated me to speak up when they weren't being listened to, when they weren't being asked to be at the table, and it's just like, go for it and just see what happens. So that fearless action was really important to me. And you got to kind of think outside the box, because kids are already outside the box, and we've kind of been jaded by society, I think, sometimes. So you got to get out of the box, and sometimes you got to put on a banana suit and act a fool. People love it. They remember it. The kids love it even more, especially if you can dance. It's kind of cool. So we dress up like giant fruits and vegetables to make a statement. So sometimes you gotta kind of be that person. Grants. People, it's kind of hard to get money that's already allocated for something else. So with our community partnerships, and just being able to market what we're doing, people are contacting us and telling us to apply for grants. And that's really, really helpful. This year, along with the student projects, we have a WISE grant program in South Carolina provided by the Blue Cross Blue Shield Foundation of South Carolina. And we were able to secure $24,000 so far for 5 student projects in their buildings, or 5 groups, 5 different schools. And we also reached out with Eat Smart, Move More, South Carolina, and did a Let's Go grant to help Grassy Pond Elementary School complete a concrete walking track. They didn't quite raise enough money to get the track completed. They needed $5,000 more. And so we were able to apply for a grant in partnership with them to finish that up. And we have an open community use policy because of my students. And so it just fit right along that we would have a safe, really nice, accessible place for people to exercise. So grants are kind of important. So ask for help in writing grants and get a team together that can really help you with that, because we know how time-consuming that can be. And advocate for accountability. With these policies that we're required to have in place, have the kids grade their school on how well are we meeting this wellness policy, and make sure that your wellness policy is based on evidence-based research that says this is what works. And I strongly, strongly recommend the whole school, whole child, whole community, whole child model. It's just foundational to help guide and lead policy development. Marketing, we make really cool videos of our schools and push that out there on social media. You got a free platform, so I definitely recommend social media. And always remember, age ain't nothing but a number. I'm working with kindergartners, I'm working with 12th graders, and in a lot of ways they're similar. They really just want to be heard. And I'm going to give props right here to Donovan. He's the student in the teal pants. He's the one that called out the data in 2014, the disparities, and really motivated me to stay the course here. These are a couple of my students. Emmy, standing there with the two young boys. Those are actually my sons. Emmy is at College of Charleston right now. She was fundamental in getting Fit Together off the ground. This is Simone standing with me in the pink shirt. That's Simone with the Delta jacket on. She's at University of South Carolina. Both of these students are majoring in public health, and they want to come back to Cherokee County and lead Fit Together. And it would be my ultimate goal to be able to establish something, maybe even freestanding or maybe part of the district plan. We're really not sure where that's going to go right now. As I'm working on a separate strategic initiative to see how to institutionalize this even more. And I would love to be able to hand it back to them and have them finish this and really lead the way in their community. So focusing on staff is important. It doesn't matter what organization you're in. Focusing on your staff will make all the difference. If you take care of your people, they'll take care of you. Listen to youth and think about non-traditional staff wellness. I brought a bunny into the district office. You can see that little bunny up there in the top right corner, just for stress relief. I mean, when people, this bunny's really cute, and you can cuddle with it for a little while, and everybody talks about how relaxed they were, and, blood pressure drops and all that. So it's really cool. And get uncomfortable. The conversations we have to have to make a big difference are conversations that are going to be monumental and disruptive. And don't be afraid to be disruptive. That's what it's going to take. Celebrate, rejoice, and shout out the bright spots. Not every group, not every project you work on is gonna be, awesome and stuff. But finding those bright spots and being sure you shout that out, and always give credit where credit is due. I'm the face of Fit Together mostly because I've been here the longest, but that's why it's so important for me to let everyone know that this is students from 2014 to now, and what they're able to do is just incredible. So we want the reciprocal collective impact to create schools that can better serve communities so that our communities can better serve our schools, and that's really what it's all about. So it's not advancing right now. At every talk, I have a huge puzzle. I think it's like 5,000 pieces. And I always give out a puzzle piece to my participants, and I can't really give you one, but virtually I'm giving you one of our puzzle pieces. Our organizations fit together and puzzle pieces fit together, but I can't build a culture of health in my community without all of you building a culture of health in your community. And we're all a part of this huge puzzle. And so it's really important to understand that your work matters to my work, and my work matters to your work. And I hope that all of you will reach out if you're interested in engaging youth and finding ways. If you have a specific question, I hope that you reach out to us. We'll be more than happy to help in any way that we can. And I've enjoyed sharing my student stories with you, and I hope you got something out of this today to be able to take to your place.
Awesome. Thank you so much, Christina, for an amazing presentation. We're going to go into the Q&A section. We have a couple of questions here, so we'll try our best to get through all of them. So the first question is from Megan. What resource are you using for students to complete that initial assessment to identify their school's needs and issues?
Perfect. So this year we actually had a local foundation sponsor us a program coordinator with Alliance for a Healthier Generation. And our state in South Carolina required districts to use or highly recommended, the Alliance for Healthier Generation assessment to report on our district wellness policies. So if I had more time, I really wanted the assessment to be youth-generated. But with that overlapping and us having the awesomeness of a program coordinator to assist our school wellness coordinators for any technical issues, we used the Alliance assessment. But it was really cool. We got online. The students went around their school with their devices or even with the paper, depending on what grade level, and they were able to assess their school. And our program coordinator with Alliance is Beth Berry, and she actually she rewrote the assessment on a lower reading level for us. So our elementary school students were able to have some independence in completing that. And that's the answers that we really wanted. We wanted our students to answer to see if our schools were providing what we said we were providing. So great question.
Awesome. So our next question comes from Kathy. How do you assess and measure disconnectedness?
That's a measure provided through the Robert Wood Johnson Foundation County Health Rankings. Disconnected youth are ages 16 to 25 that are not enrolled in school and are unemployed. So you can look up your county health rankings. I'm sure you may be familiar with that. And you can get your rates, and they were recently updated, I think in February. And so you can get all that data there to see how that is. So that was a measure provided by the Robert Wood Johnson Foundation.
Awesome. And then Elizabeth asks, how are you building sustainability and what things are in place to maintain all this wonderful work?
So right now, the whole reason I'm able to expand the program to other schools is we received a grant from America's Promise Alliance as part of their Healthy Schools Initiative work. And so there were 6 sites selected, and we were one of those sites. So within that funding, it funded my salary to be technically a district wellness coordinator. And so I hope and this is our first year in the grant, and it's a 2-year grant. So for sustainability, I hope that the district will see the value in what we're doing and be able to continue the program. However, other districts have contacted me about bringing the program to their district, or at least certain parts that fit, depending on the needs of the district, that it would look different in each district, which is what I like about the Wisk model, is that you can make it fit depending on what your needs are. So right now, that's a great question. I decided this year not to even worry about sustainability and really just focus on putting all of my energy into the kids programs. And I just honestly feel like their programs are going to keep going because they're going to train students if they have a score. If they're working in policy, recess will always be a policy. And then as they change the policy, so right now it's 20 minutes. Next year we're going to have kids come and speak to the ones that are on an extended recess and hopefully change the district wellness policy and get a little more accountability. So that's where I am right now. With my work in RWJF, I have a little opportunity to develop a strategic initiative, and they're really kind of inviting to institutionalize this. So I'm not sure if it needs to go nonprofit, if the district doesn't see that there's funding available for it. Really, if you have a champion and you have an advocate in a building, in a school building or something like that, that's really all you need. And so it's just, you can find funding for programs or projects and stuff like that. So that's where I hope we're district led, or student led within the district. So
Great. And then, kind of similarly, Megan asks if one group or grade level comes up with a project that might require ongoing efforts from students, how do they sustain that when those kids who originally started leave or graduate?
Right. It is a marathon. It is not a sprint. That is true. I feel like the kids themselves build a following around it. And so we have K through 5 schools. Most of our schools are K through 5 for elementary, 6 through 8, and then 9 through 12. And there's always a cycle coming through. And so you have those teams are built up of multiple grade levels. And that's really what's going to keep this going. And so having the school wellness coordinators recruit the students that we're interested in, involving and getting feedback from, those projects can continue. And the other part is, not just working on one project a year after year. How is this going to look, with other issues that were brought up that weren't prioritized? So it may have been second or third choice, but it was still an issue that students were involved in. So, being able to have a coach in the building that doubles as a nurse, they may be a guidance counselor, maybe a teacher. There's an administrative assistant that does an amazing job working with kids. And so just finding those champions in the building that can pull those kids together and then basically just amplify what they do.
Awesome. And then, so we have 3 more questions, but I'll only ask you one. But Christina's contact information is on the screen, so feel free to reach out to her directly if you have additional questions. But one question from Jordan: do families get involved with the youth wellness activities?
So it kind of depends on what the youth are up to. I know as far as some of the policy that we want, my focus is having student voice, and we really haven't had to reach out to parents to solidify that because our principals and our people in power are listening. But we definitely involve the parents in look what your kids are doing. We're so excited about this. And most of our meetings happen during the school day just for accessibility because, some schools ride buses and parents don't have transportation. We don't have a transportation system here in our county. And so it's really important to make those meetings and get-togethers accessible. But in our celebrations and whatnot, the parents come. But we really put all of the challenge on the students, and they're stepping up. And so focusing on nutrition, engaging the parents through their programs is one thing. And then some of their programs don't really engage parents at all. So those messages are getting home, though, and those priorities are getting home, and that means a lot to me as a teacher and a parent. So.
Awesome. So in wrapping up, we just wanted to let everyone know that Sophie did just release a new resource in January. And so if you're interested in getting more information about this ebook titled Underserved Populations, Advancing Health, Engaging, and Developing Research Handbook, or the Up Ahead Handbook, feel free to visit the website on your screen, and you can buy this resource on Amazon. And so on behalf of Sophie, we would like to thank our presenter, Christina, as well as all of the participants today. Once again, today's webinar was recorded and will be archived within 2 weeks on Sophie's Core, and it will also be available on YouTube for viewing. Please take a moment to complete the brief feedback form that will pop up in your internet browser following this webinar. Again, if you are interested in continuing education credits, please visit Sophie's Core. Thank you. This ends our session today.